Welcome back. I'm here with our resident financial expert, Derieck Hodges, and we're going to talk all about open enrollment season for healthcare. You guys are probably in the midst of that right now. So let's talk all about it, Derieck. I know healthcare and benefits, those aren't the most exciting subjects on earth, but it's so important. And why is it so important?
You know, there's all kinds of studies that when you get to retirement years, the healthcare costs are in the hundreds of thousands of dollars. So this is kind of a foundational financial planning topic because if you don't have proper coverage on this, you can really devastate your financial future.
Oh yeah, for sure. And there are so many different plans out there, but what kind of plans are there?
Yeah, so we're in this busy season of a bunch of different health enrollments. So we're in the Affordable Care Act for individual health insurance, and we're also in that Medicare season of open enrollment. So typically somebody over 65 is on Medicare, and people under 65 generally are going to be on traditional health insurance or an employer-sponsored plan. And so you need to kind of dissect where do you fall, and there are people who work beyond 65 who could be on an employer plan.
Most definitely. And you know, are there really any key dates that people need to be aware of at this time?
Yeah, so we're in open enrollment presently for Medicare open enrollment. So that's for Medicare Advantage, a type of Medicare, and for the prescription drug plans. And then we're also in the Affordable Care Act open enrollment season. And so I think you're going to show some dates when those start to go out. One of them goes out December 7th for Medicare, and then I believe it's January 16th is for the Affordable Care Act.
And you know, taxes and tax situations, that can impact health benefits. How is that so?
Yeah, it's really odd, isn't it, to think taxes and insurance, but it really does. So things like Medicare, you pay a Part B premium when you go on Medicare, and if you make more money than approximately $190,000 a year, you can actually pay an additional surcharge. On the Affordable Care Act side, there's a premium subsidy that you can qualify for. So if you can keep your income below a certain threshold, the government actually will help pay your premium. Very important, and there's a lot of tax strategies that you can do that are very legal that you can do to qualify for greater subsidies.
That's interesting. And you know, something else that's pretty interesting is that quite a few people may have heard of a health savings account. Can those be helpful to us?
Oh, massively. We like to think of them as kind of the triple threat. They have triple tax benefits. So you can put money into a health savings account, sort of think of it like a retirement account. You get a tax deduction on the money you put in. Then it grows tax deferred, meaning you don't pay any tax on the interest that you earn. And then when you pull it out for health care, you don't pay tax on it when you take the withdrawals. So it's a really powerful tool. Not everybody qualifies for them though, so you have to make sure you have the right kind of health plan.
Yeah, that's definitely something people should look into if they have that available to them. And you know, are there any differences between like prescription drug plans?
Oh, very. I'm glad you brought that up because right now, especially with Medicare, open enrollment season for Medicare Part D, that's the prescription plans. And sometimes folks will just say, I'm just going to keep my same plan. The reality is all these plans, these prescription plans, change what they call the formulary, the list of drugs, and they change those year by year. So it's really important each year you take your list of medicines, match it up with your health plan, and see if it's still the right plan. If not, you might need to pivot to a new plan.
Right, most definitely. Well, that's all such important information to know for this open enrollment season. And I know for like some companies, they have hard deadlines for their own companies when you have to, you know, apply for open enrollment. In some cases, if you don't apply by that deadline, you lose the chance of getting a, you know, your benefits, correct?
Yeah, unfortunately, it's during this crowded season when we're all doing fun things. But yes, this is the time. You got to pay attention to those dates, and you do not want to miss those.
Yeah, super important. Well, Derieck, thanks so much for joining us on The Breakfast Show, too. We always appreciate it. We'll be back in just a bit.